Wonderful. And here we go. So as you know, we now have a live feature every seminar. So we get different, so we get insight into recovery community centers and how different they are and how unique they are. Today, we are very excited to introduce Nick Demott from Lifeboat Recovery to you all. And Nick is going to give us some insight into his RCC. Nick, over to you.
Hi, everybody. Yeah, I'm Nick Demott. Lifeboat Network Center is the name of our RCC. We're located in Lansing, Michigan. We launched fairly recently. We've been open since October. So building out the sort of community engagement piece of our RCC has been a little slow going due to COVID. We had a round of shutdowns in November shortly after we opened. And so it's been, we really are trying to set ourselves up as a drop-in center where, you know, anybody from the community can come in, catch a meeting, maybe just have some, we have kind of a lounge area where folks can kind of hang out, talk, socialize. We're trying to build out some sober social events and volunteer opportunities, like some cleanups in the community. And we're starting a community garden, but it unfortunately got flooded. So that one might have to be put on hold till next year. Yeah, part of the focus of our RCC is just our one-on-one coaching. That's probably been kind of the core of what we do. We have, I think, 11 active clients, and then we've done a lot of relationship building with transitional housing programs, treatment providers in the area, community mental health, to set up referral relationships with those folks so that as individuals are transitioning out of their Medicaid funded peer recovery coaching, Lifeboat can kind of be there to you know, fill that gap where if an individual wants to continue services but they run out of funding, they can come over to us. So we're strictly grant funded right now and don't bill. So we're able to be there for folks when some of their other funding runs out. We also have quite a few support meetings. I think we're up to 12 a week right now. Some of them are bi-weekly. But yeah, I mean, we've been seeing around 100 to 120 individuals a month in support meetings, and we're kind of constantly trying to grow that. We have a couple of meeting rooms right here in house, as well as our building has some larger conference rooms for bigger meetings. We're also trying to integrate like a family engagement component, which actually just launched last night with there's another community partner that offers a family support meeting, and they've wanted to expand. So they're starting to meet in person at Lifeboat. And really just throughout the pandemic, we've tried to find ways to offer, you know, COVID conscious in-person support meetings, because a lot of folks have mentioned that was something that, you know, they were really struggling with in their recovery, was not being able to go out and see folks in person. We also have a computer bank here on site. So we have 4 computers that are open to the public. That's kind of during our public drop-in hours, or people can set appointments. We also work with coaching clients, you know, to get on there, and if they need to sign up for public benefits or look for a job or try to find housing. We've also had individuals come in and do community college classes and things like that. So that's kind of just, they're kind of just there for a broad, you know, helping people with sort of whatever recovery capital type stuff they're needing to work on. And, you know, sometimes using a coaching session to really sit down with a client and work on that stuff can be beneficial, because, you know, if they're consistently setting a goal and not reaching it, sometimes you can just take that 1 hour time to help them knock some stuff out and get some forward momentum. A couple other things we're working on is we'd really like to build out a training and mentorship program. That's been kind of slow going, but we work closely with some community partners like that provide the CCAR training in our area and have a kind of a wealth of knowledge of, you know, various training modules that they can offer. So we're really trying to recruit individuals from the community that, you know, want to work in the field, want to become coaches, offer them some training, and then also pair that with opportunities to shadow coaching, shadow. There's a hospital-based initiative here in Lansing, not run by Lifeboat, but it's Project Assert. And so just opportunities to kind of shadow some of the peer support services. Like I said, that's still something that's in development, but that's kind of one of our goals, is to really have that up and running. And then 2 other things I'm really excited about that we have kind of just recently launched are the rapid response post-overdose program. So it's a collaboration with some community, like law enforcement, EMS agencies. So Lifeboat and a couple other sort of treatment providers receive referrals from first responders, and then we follow up on those overdoses. The goal is within 72 hours. We're piloting a home visit program, but since September 2020, we've been making phone calls to the majority of the overdoses we're following up on, and it's taken some time to really get it working well, but we've started to see a lot of good engagement. I think we responded to like 13 overdoses in June, and a lot of those resulted in like Narcan delivery, linkage to various services, whether it's a peer coach, support meeting, finding a primary care doctor, or in some cases, even the individual entering treatment. So that's been really awesome to see. And I kind of lead that coalition. And then I guess final thing I'll touch on before I wrap up, I know I've covered a lot of ground, is the outreach initiative. So I mentioned Project Assert. It's a evidence-based practice that engages people in the emergency room, and Lifeboat is working on expanding that program into some of the homeless shelters and other community agencies that serve underserved populations. So right now we're in the it's called the outreach. It's like an overflow for the homeless shelter, where especially individuals that are intoxicated can go there. So we're staffing a peer recovery coach there a couple hours a week, and we're trying to up the number of hours that they're at that location, as well as expand into some of the other services to really just kind of meet people where they're at. So yeah, I think I'm about out of time, but thanks everybody.
Perfect. Thanks so much, Nick. Greatly appreciate it. Now I will turn over to our presenters for our main feature, so to speak, today.